Welcome to our boot camp series. My name is Amy Rich, and today is boot camp day 7. The topic is Certified Workers' Compensation Healthcare Networks. We know you've been working out a lot with us, and day 7 takes you through that obstacle course from the climbing net to the climbing wall. We're going to get to that wall of information about Certified Workers' Compensation Healthcare Networks. Our learning objectives today are to learn what is a workers' compensation or a certified workers' compensation healthcare network. Know how to find those networks that are in your clinic's area, or if you're an employer in your area, and how to apply to become a network healthcare provider. And to understand the importance of identifying those injured employees as they seek care in your clinic or your healthcare provider location. So Certified Workers' Compensation Healthcare Networks. Before we get started on the content, I want to remind the audience that this presentation, we do our best to provide education to system participants. However, system participants, you all are responsible for knowing the insurance code, the labor code, that's the law, and the administrative codes. Those are our rules. Because if there were ever a disagreement with what I've said or what we've presented, or if there's a complaint or a fee dispute, any type of complaint or dispute, the law and the rules will prevail. Every word in those rules and laws matter. So just know that you are responsible ultimately. However, we're doing our best to educate you with this presentation. An overview of what we're covering today. What is a network and how can a healthcare provider join one? What are the network notification requirements? Also, we'll go over network intake and registration procedures. Again, we talked about that in the earlier boot camp, but it is important if we're talking all networks, we need to understand how important it is for your registration staff and their intake procedures. And specifically about networks, what are the pre-authorization requirements if you're treating a claim or an injury that is subject to a network? The medical billing and reimbursement for network claims, and dispute resolution. And then lastly, how does the Division of Workers' Compensation monitor network operations? We do have report cards that we publish on our website, and we'll go through that. So what is a Certified Workers' Compensation Healthcare Network? Let's just start with the basics. Back in 2005, House Bill 7 was passed, and it altered the labor code 408.031, and it created a chapter in the insurance code. Remember, there's 2 sets of laws that workers' compensation uses in the state of Texas. This is where the insurance code, chapter 1305, and the labor code work together to provide workers' compensation network coverage to the employers of Texas for their employees. If there were ever a conflict between 1305 and 408.031, 1305 is going to supersede any of those conflicts. So this is when they work together to provide network coverage for Texas employees. So a network is an organization, and it is not always the same as the insurance carrier. It's most often as a separate company. It's formed as a healthcare provider network to provide your healthcare services to your injured employees for those employers that have chosen to have workers' compensation coverage. Those networks have to be certified by the Texas Department of Insurance in order to operate in Texas. And they operate under a contract with an insurance carrier. So the network isn't necessarily the insurance carrier unless the insurance carrier is also certified to be a network. Most of the time it's a separate entity, and they contract with an insurance carrier. And their healthcare, they're making contracts with the healthcare providers. So let's just look at employers in Texas just to remind ourselves that in Texas, it is optional for an employer to have workers' compensation coverage under the labor code. We're not talking federal employers here. Those are covered by the Department of Labor. This is Texas employers. On the left-hand side are those employers that have chosen to opt in to the workers' compensation system. It's generally elective for them to do so. So for those employers that have chosen to have coverage, on the left, those employers that have chosen not to have coverage are on the right. We call those employers non-subscribers. Now, they can have some smaller policies like accident or umbrella policies. They're not likely to cover all the punitive damages if there were ever a lawsuit or court costs if you were sued, if you're an employer and someone got hurt on the job. And there are some employers that don't even have those smaller policies. They go without coverage at all. Their employees retain their common law rights. On the left-hand side, if you are an employer that has chosen to have coverage, we call those generally subscribers. So they're part of the workers' compensation system. Some employers have purchased a commercial policy. Some are certified self-insured. Those are larger employers that can are large enough to insure their own employees, but those are only operating as a certified self-insured if we, the Texas Department of Insurance, Division of Workers' Compensation, certify them. There is a list of those certified employers on our coverage page. Also, if the employer is a self-insured government employer. Now, there are some employers that have to have workers' compensation coverage, like the state of Texas, where I am employed. So they're compelled to have workers' comp, but most private employers choose to have coverage or not. Now, the employer is the insured. The employer is the one that chooses to have workers' comp coverage or not. So once you're a covered employer, you're a subscriber, and you may participate with an insurance carrier that provides network healthcare for your employees. You choose that. So if you're out shopping for a policy as an employer, you can buy a commercially available policy from an insurance carrier, but that insurance carrier may also offer a network coverage for your employees. You choose as the employer to have coverage and to choose to become to offer healthcare services through a network for your injured employees. So again, if you're a healthcare provider out there, know that it's the employer that's the insured, and it is the employer that has chosen to become part of a network. So the employer should ultimately know if their employees are subject to a network. When you're trying to verify whether it's a network injury or not, call the employer if you're in question, and we'll review some of that later. Currently, if you're a healthcare provider out there, 50% of new injuries or new claims, if you will, are subject to a network, and the other 50% are non-network. So keep that in mind if you're deciding whether your healthcare provider should join a network or not. That's how much penetration is in Texas as far as this managed care sort of workers' compensation certified networks. Now, once we're talking about provision of healthcare services for injured employees, we've kind of delineated 3 different ways that someone who's injured in Texas can receive care. And this is obviously for subscribing or covered employers. I'm not talking about non-subscribers. We do not have jurisdiction over how they receive healthcare, their employees. So employees of covered employers receive healthcare on the left by certified workers' compensation networks. That's covered by the insurance code 1305. We call those network claims or injuries. Then the other is the non-network. That's covered by the labor code 408 and section 413. We call those network injuries, non-network claims or non-network injuries. Now there's also a separate category called public employers or political subdivisions. Maybe they're intergovernmental risk pools. School districts come to mind, sheriff's association come to mind, some first responders, cities. Those can fall into this category. And this category is governed by the labor code, section 504. And in 504.053, it says these types of employers providing healthcare through their coverage, they can operate in one of 3 ways. They can operate like a network. They can operate like a non-network, or they can direct contract. Say it's a small town, they have one hospital, 3 clinics, maybe they're direct contracting with those healthcare providers. So basically, they're going to be a contract involved with a network or a political subdivision that has a contract or non-network. So that's how it breaks out in basically 2 categories, but the public employers needed to point out that they're subject to 504 of the Labor Code. So if you're a healthcare provider, sometimes we get calls in Comp Connection. Some of you want to know, well, how do I know who the networks are and how do I find a network? We have tools on our website. You can search for the network on our website by their name or by the county. We have 254 counties in Texas, and you can do that. I'm going to flip over to our website for a minute and show you. So here's our website. Remember, the first thing you're going to go do at tdi.texas.gov is to click on the Workers' Compensation tab. Remember, TDI is very large. There's different tabs. We're here in the Workers' Comp area. We do not use this A through Z up here. It is down here. Workers' Compensation A through Z. And then you can go to N for networks. Networks is right here. Here are those report cards I talked about. And then how do I find a certified WC net is our abbreviation for Workers' Compensation Healthcare Networks. The list of the networks are right here. And every one of them has a link over to their website right here. See, this is not very many for the state of Texas. You can also search by county. So if you're in Cameron County, Texas, where I grew up, right here, Cameron County, here are the networks that operate in Cameron County. So if you're a healthcare provider and you want to know where the networks are, you can search by your county or look at the map. They're all covered by workers' compensation networks. There are networks all throughout 254 counties in Texas. Now back to our presentation. So I have screenshots for those of you taking those slides away, screenshots for finding that information so you can reference it later. So again, our workers' comp A through Z, N for network, or any other topic you can search. This is the appropriate A through Z. I think it's easy to get around our website. How do I find a workers' comp net? And then you can look for different ways to search for it. How can you join one of these networks? And when I say provider, I mean hospitals and different types and not just doctors and nurses. So any type of provider, how can you join? First of all, I would suggest you find the networks that are in your area. Maybe even talk to the employers in your area and see if they've joined a network. That would put you ahead of the game, knowing who to contact. Also, you can create a profile for yourself in our TexComp system. It's a database. Both facilities can create a profile. It's not required for facilities. What is required if you're a healthcare practitioner, which is an individual healthcare provider, you need to maintain your profile, keep it up to date with addresses, your training and certifications, and any financial disclosures. That's where it becomes required. If you have any financial interest in any other healthcare provider, you need to report that in your TexComp profile and any other information. I also wanted to show and highlight that we've created a checklist for treating doctors. This is just to become a treating doctor and also to help you join a network. So there is a checklist on our website. It looks like this. I'm going to go over to it right now. So I'm going to go backwards. I'm going to hit the workers' comp tab again. Remember, I'm not going to use this A through Z. I'm going to go just directly to the healthcare provider website, which, by the way, we revised, and it's got 9 tiles here of information for you. One of them is become a Texas workers' compensation healthcare provider. That very first link is the checklist for treating doctor. It also talks about networks and non-networks and how to change treating doctors. So this is a new tool for you. It's got links on it, live links, and of course, Comp Connection. So new tool, it'll help you get started if you wanted to join a network. Back to the presentation. So also under N for networks, you can find information for providers. Under information for providers, you can see that there is a standardized credentialing application that you can send to the network in the one you want to participate in. However, Texas is not an any willing provider state, meaning just because you want to join XYZ network does not mean they have to take you. You can try, you can apply. They're going to be looking at all things about your healthcare practitioner, your healthcare provider, to decide if they want to credential you and accept you into the network. So there's your standardized application. I would contact the network directly to ask them what else they need. Do not send that application to TDI. That goes to the network. Remember, if you're filling out an application for your healthcare provider to join a network, do not send it to us. These are contracts between a network and a healthcare provider, not us and a healthcare provider. So send it to them. Now, the network's going to have a credentialing committee that's going to be reviewing that information. They must complete the initial credentialing review within 180 days prior to your applicant becoming a credentialed provider. And the applicant must be notified of the network's credentialing decision no later than 60 days after that decision. And they have to re-credential you every 3 years. I'm going to show you information for providers here on our website real quick. So workers' comp, remember our A through Z, N for networks. Networks. Now down here, there's information for providers. Way down here. There's also information for employers, for those of you out there that are employers. Information for providers. What are my responsibilities? What are the credentialing requirements? All of that information is here. This is where I got that information about the application and the 180 days and the 60 days and every 3 years, right here on this web page. Reminder, do not send your application to us. Send it to the individual network. And the rules or the administrative code that govern workers' compensation certified healthcare networks is in Part 1 of the Texas Administrative Code. Specifically, this one, 10.82, is credentialing. And it says that you, the provider, have a right to review all the information they looked at to make a determination about credentialing, and maybe even correct any erroneous information that they've been looking at. So you have an opportunity to do that. You can see that outlined in 28 TAC Rule 10.82. And just to show you where that is on our website, that chapter, remember, Part 1 and the insurance code is under this tab. I go to the insurance laws right down here. Their administrative code, they being Texas Department of Insurance, right here. Chapter 10 is all about workers' compensation healthcare networks. This is a different set of chapters than our workers' comp chapters. Remember, we work together with both the laws and the rules. So this one applies here. And that's where I'm getting the 10.82 under certification, under credentialing and contracting. There we go, 10.82 here. That's where that rule is. Now let me go back to the presentation. Now know, if we've certified a workers' compensation network, they are required, they have lots of requirements. They're required to document create policies and procedures and written criteria of how they credentialed their providers. So that's part of their certification is they have to have a documented procedure on how they credential their providers. It's also part of their work plan as outlined in that 10.81 quality improvement. They have to show that to us on an annual basis. And the network's credentialing committee will verify the information, and they may also come see you. They may conduct an on-site visit during that credentialing process. Now let's talk about the network requirements, specifically about notification. Notice of network requirements. Who's responsible for what? First of all, the insurance carrier, remember that's separate from the network. The insurance carrier provides the employer notice of network requirements. The employer, for those employers out there, you're going to need to get a signed acknowledgement from each employee that the employee has received network information and the requirements that the injured employee has because he or she is covered by a network if they get injured on the job. So employer, you got to get a signed acknowledgement from the from the employees as you hire them and as injuries happen. You also are supposed to post notices of network requirements throughout your place of employment. And then at the time of the injury, like I said, notify the injured employee of the network requirements. That's found in the insurance code 1305.005, participation in network and notice of network requirements. This is super important for an employer to know their responsibility and the insurance company to know their responsibility also, because injured employees need to get the right health care at the right time, and this is part of that. The injured employees' responsibilities and requirements include selecting a treating doctor from that list of contracted providers or panel of providers, similar to managed care in the commercial insurance world. So they need to pick a list. Do they know how to get to that list of doctors? That's important for employers to let and carriers to let the injured employees know where to find those lists of contracted doctors. Now, the network decides what specialties of doctors may serve as treating doctors. The workers' compensation law says that chiropractors can be treating doctors, but 1305 may conflict there. And if so, the network can say, we think MDs and DOs are the only types of doctors can be treating doctors, and chiropractors will be specialists. These networks can decide that who are the specialties of the doctors that may serve as treating doctors. The injured employee is entitled to their initial choice of treating doctor. So they can look at all the doctors on that list, and they're entitled to their very first choice of treating doctor. Now, if they want to change that doctor, they can select a second or an alternate treating doctor from that list, and the network cannot deny that selection of an alternate network doctor. Any other requests after the first and second will be subject to review by the network. And so those subsequent requests must be authorized by the network. Also, this is important for healthcare providers and injured employees for that matter, and their employers. If the injured employee chooses to go to an out-of-network provider without approval, they may be liable for payment for that non-emergency healthcare. So if the injured employee goes to an out-of-network provider, they can be responsible for payment of that bill if they didn't get written approval. And the injured employee is not required to choose from the network list of providers if they didn't know they were part of a network. So that's where the notice comes in. Really, we need to emphasize that the carrier needs to tell the employer needs to tell the injured employee that they're part of a network, because the injured employee does not need to comply with the requirements of selecting a network doctor if they don't know about it. The insurance carrier is liable for payment of the medical care until that injured employee receives notice. So insurance carriers are motivated to make sure the injured employee knows, and so are the employers. And the injured employee needs to select once they are notified that it is a network that they're subject to, and they need to pick from the selection of network doctors. What is a treating doctor required to do? Well, first of all, they have a business contract with that network. That network contract needs to be accessible to staff that needs it, and the treating doctor needs to know what is outlined in that contract. And it says that they must provide health care to the injured employee's compensable injury. That's part of the contract. That's the main reason they're having a contract, is they're going to be providing health care to those injured employees of those employers that have chosen to be part of a network. And they're going to make referrals to other network providers, maybe specialists, different types of providers. Or if they have to go outside of the network for medically necessary services that are not available in the network, they have to get special permission. They have to request that out-of-network approval in writing. They're going to follow, so the treating doctor must follow the pre-authorization requirements. And where are those found? In the contract. That's what I mean about having the contracts accessible to staff that needs it. Have the pre-authorization requirements available to your pre-authorization department. Each contract could be different. So if you have 6 contracts, then 6 requirements need to be available to your pre-authorization department, your billing department, your intake department. Follow the network's adopted treatment and return to work guidelines. Every network should have in the contract which guidelines, evidence-based, scientifically valid treatment guidelines, and return to work guidelines identified in the contract. So that doctor that signed the contract needs to know what the evidence-based medicine that network is using. It can be different from the official disability guidelines, which is used for non-network treatment, or it could be the same. Check your contract. Also, the contract is going to require them to participate in medical case management. This is really important. It includes participation with return to work planning. This is to help meet our mission and goals of the workers' compensation system. You'll see on the network report cards that a lot of the networks have really good return to work outcomes. Treating doctors are required to participate in case management processes. Now let's talk about adequacy of care and accessibility. The network, in order to become certified, they have to meet certain conditions for accessibility and availability. Their provider panel must include an adequate number of doctors, treating doctors, specialists, and other types of healthcare providers who must be available 24 hours, 7 days a week within the network service area. Or they must arrange for non-network, out-of-network services if a skill or specialty is not available within the network service area. So if they're looking for that subspecialist and they don't have one in the area, they need to arrange to find that specialist for that injured employee. Also, hospital services are part of the adequacy of care for their network. That includes general, special, and psychiatric hospitals. They must be available to those injured employees 24/7 within the network service area or arranged outside of the network. Emergency care for network claims. The network claims can go to any emergency center if they need to, whether they're contracted or not. But emergency care must be part of that adequacy of care. In order to get certified, they must be available and accessible 24/7 without restrictions for where the services are rendered. So that's about network accessibility and availability requirements. An insurance carrier that contracts with a network is liable for the out-of-network health care if it's emergency. So the carrier is going to be paying for that emergency care no matter where the injured employee goes. Emergency care, it should not matter if they're contracted or not. Healthcare provided to an injured employee who does not live within the service area. So maybe I move. They're going to need to follow me because I get injured on the job. Healthcare provided to an injured employee who does not live in the service area. That's insurance carrier is liable for payment of that. And then healthcare provided by an out-of-network provider approved in writing by the network. So the carrier is going to have to pay for those things for a network claimant. So out-of-network healthcare. Referrals to out-of-network providers must be approved not later than the 7th day from the request of the referral. So if I'm a treating doctor and I need to find a neuro-otologist or ophthalmologist, maybe that's a subspecialty. You put in a request for that out-of-network provider. They must respond to you in 7 days. And if it's a denial, the injured employee may appeal that denial of that referral through the network complaint process. The network complaint process should be outlined in your contract. If you do get approval for that subspecialist or that specialist, that does not mean you've gotten pre-authorization. That's another hurdle. That's just written approval to go see that person. If any of the services that a specialist provides needs pre-authorization, that out-of-network approval does not count as pre-authorization. That's a separate activity that needs to be secured if the service needs pre-authorization. Network intake procedures. We've also talked about this in identifying a workers' compensation patient boot camp series, but we're going to review it now because it's really important for your intake and registration to help you mitigate and reduce the possibility of treating a network claimant when you don't have a contract. You could be denied payment just because you're not contracted. So you need to identify those injured employees that have claims subject to a network. In your intake procedures, the first thing for every patient that walks in the door is to determine if the treatment they're seeking is for a work-related injury. Is it a work-related infection, occupational disease, injury that happened at work? You're going to be asking every single person you treat whether the injury or illness is work-related. That'll get you a good start in your intake and registration procedures. And then if they say yes, then you need to identify the employee's employer on the day of the injury or incident. Because if they've changed jobs 3 times since then, it's not the newest employer, it's the employer where they were hurt, the work-related injury for the employer. And that employer is the insured. So you'll need to find out who they were covered by on that day and if they were part of a network on that day of the incident. So is this treatment work-related? And if so, who was the employer? And if it was a covered employer, was it a subscriber? And were they part of a network? Also verify if that employer is a political subdivision or one of those other types of employers where you have to decide if there's a contract or not. If it's a political subdivision, polysub, sometimes we call them, or subscriber, need to find out if it's subject to a network by asking everybody. I'll start with the injured employee. Remember the notification requirements? The employer is supposed to let the injured employee know upon hire and upon injury that they are subject to a network. The referring healthcare provider, maybe you're the subspecialist receiving a call from a treating doctor, one of those urgent care clinics. You're going to be asking them, is this a network claim? So then you can start to do the work on your end to find out if you're contracted or not. Ask the employer. Remember, the employer is the insured. Ask the adjuster, the insurance carrier representative. And if yes, determine if the healthcare provider has a contract with that network, because that's the key. If you don't have a contract, then you need to get special out-of-network approval. Kind of gotten ahead of myself, but if the healthcare provider is not contracted with the network or political subdivision, you must request in writing an approval before treating an injured employee that's subject to a network. Injured employees claim. Remember, one person can have 2 or 3 injuries. So it depends on which injury they're asking for treatment for and that employer. And if that employer is part of a network, then you need to check and see if you're contracted. Emergency care, remember, they can go anywhere for emergency care. Approval to treat an injured employee subject to a network is not the same thing as pre-auth. I have said that earlier, but just to distinguish, it is 2 different things in writing. We've developed this flow chart for you and your intake and registration procedures. Everything I've said today is in this flow chart. This should be available to your intake and registration staff to determine if a work-related injury you're treating is subject to a network or not, and whether you get network approval. So we also have a key there for all of our acronyms we use in workers' compensation. The network pre-authorization requirements. In Insurance Code Chapter 1305 and Subchapter H, Utilization Review, you will find the regulation around network requirements. So the pre-authorization requirements of the Labor Code do not apply to healthcare provided through a network except for pharmacy. The closed formulary applies both to networks and non-networks. So basically what this is saying is check your contract for the network requirements for pre-auth and the steps to request pre-auth. Here is the pharmacy that applies to both. Pharmacy cannot be provided through a certified workers' compensation network. 1305 carves out pharmacy. So the non-network rules apply. And the pharmacy formulary applies to network injuries and non-network injuries. Now, how it works is that we have a closed formulary in that circle on the left. All FDA-approved drugs are within our closed formulary. And those items that are outside or excluded from our closed formulary are the ones that need pre-authorization. So if you're on the left-hand side, you do not need pre-auth. If your drug is on the right and you're writing a prescription for that drug, know that if it's a drug with a status of N, you find that in Appendix A of your official disability guidelines. Or on our website, there is a list of N status drugs free and available to you to know which drugs need pre-authorization. Investigational or experimental drugs, or all prescription drugs that are compounded. So it doesn't matter if the ingredients in that compounding solution are not N drugs, just because they're compounded, that means you need to get pre-authorization. So this is just an illustration for you to understand how the formulary works for both network injuries and non-network injuries. Each contract outlines your pre-authorization requirements and process. Make that contract available to your pre-authorization department and your billing and collections department. That is important to know. Pre-authorization for emergency is not required. Payment may not be denied for medical necessity when you've gotten pre-authorization. We've talked about this a lot. So if the carrier says, yes, we think it's medically necessary, and here we're granting you pre-authorization, they can't come back and say, we don't think it's medically necessary now. But however, you need to understand that just because you got pre-authorization, that's not a guarantee of payment, because there are other issues for a bill not to be paid. But if your service needs pre-authorization, obtain that pre-authorization and knock the medical necessity defense off the table. You've covered it during pre-authorization. The other reasons your medical bill may not be paid are issues about compensability, extent of injury, relatedness, or liability. We call that SURL. So those are reasons. Not the same. Those are different from medical necessity. So if there are issues like that, your bill could be denied. If you did not code with the correct CPT codes or other types of codes, or billing or your documentation does not support the choice of codes in the billing services that you sent, that could be a reason why the carrier could deny your medical bill. Did you miss your timely filing? Did you miss a deadline? That could be a denial. And the last thing is, you can be denied payment just because you didn't get written out of network approval. If you're one of those doctors that are not on the panel, you don't have a contract, and you start seeing a network claimant. Make sure you have in place that written out of network approval. It's not the same thing as pre-auth. Let's talk about getting your bills together. What is the medical billing and reimbursement requirements for network medical bills? You'll find in 1305.153 provider reimbursement and the general medical provisions from the Texas Administrative Code, Chapter 133. Remember, we work hand in hand with 1305 and the Certified Workers' Compensation Administrative Code plus our Administrative Code. So you're going to need to know both. There is one rule, 133.1, that talks about the applicability to network claims. And it says that all of our medical billing rules apply to network claims except, and then it just outlines these couple of things that are exceptions to medical bill processing. One is Rule 133.210, and that is relating to medical documentation. The networks can change the medical documentation requirements so they can be different from non-network claims. They can reduce the amount of medical documentation that's required. So check your contracts about that. Also, just the way they process reconsiderations and disputes of medical bills, that is different from the non-network. And we'll go into that in just a minute. So there are exceptions. All the other billing rules do apply. In fact, you must submit your medical bills within 95 days from the date of service. That's the same thing as non-network, with the exceptions we've talked about in the previous boot camps. That's if you bill the wrong place, the wrong carrier, or you don't find out it's work-related. But however, during your intake process, that's when it becomes very important to ask every single injured employee, every single patient, whether the treatment they are seeking is work-related or not, either upon intake or upon discharge. It's important to ask. The insurance carriers also follow the same rules. They must pay, reduce, or deny within 45 days from receiving your complete medical bill. What's a complete medical bill? Then you can follow the rules in Chapter 133 to know what goes in each field of your CMS 1500 or your UB04, whatever your billing form that you're using. Medical reimbursement for medical services provided to a claim, an injury that's subject to a network. The reimbursement is determined by your contract. Someone at your organization has agreed to that contract, and that contract has the dollar amounts that should be paid to you for every service. So if you're wondering what it should be, check your contract. Sometimes those contracts are based on our medical fee guidelines for non-network services, minus or plus. I don't know because I don't see contracts. We don't have them at the division. So you might want to learn how non-network reimbursement works if that's the case. I don't know that's the case. Check your contract. So reimbursement is determined by contract. The exceptions are if your network claim, that's a person that has an injury that's subject to a network, goes for emergency health care, that follows the non-network rules for that reimbursement. If your health care is provided to an injured employee who does not live in your service area, or there's an approval for an out-of-network healthcare provider, you are being paid according to our medical fee guidelines. So those are the exceptions. The rest of the reimbursement comes from your contract. Other exceptions continued. Designated doctor and RME exams follow our medical fee guidelines. There's a specific fee guideline for each of those. Designated doctor, required medical examinations. They are not subject to network discounts for those examinations and those medical bills. In addition, any referred doctor, so if a treating doctor needs an impairment rating assigned or an MMI examination for their injured employee, they send them to a referred doctor within the network. The network contract discounts do not apply to MMI IR exams for a referred doctor. We follow our medical fee guidelines. Also, treating doctors who happen to be certified in impairment ratings. Those impairment ratings are paid according to our medical fee guidelines and should not be subject to impairment rating. Should not be subject to network discounts. However, the MMI exam from the treating doctor is subject to the network discounts because they're being paid an office visit amount. Treating doctor examinations to define compensable injury are also paid according to our fee guidelines. I have an asterisk by the change on the referred doctors, MMI, IR, and treating doctor impairment ratings not subject to network discounts. See Chapter 134 rule revisions effective June 1st. So that was a June 1st change with the MMI impairment rating rules being changed earlier this year. Now, if you're receiving an explanation of benefits, you're going to be looking at it. This is your collections department looking at the EOB. Maybe you didn't know it was network. Hopefully you found out during registration or intake. But if you're looking at that explanation of benefits, know that you're going to have the name of the network on there. Also, if there's also another nuance, of course, pharmacy, DME, and home healthcare services can be part of an informal voluntary network. That name should also be on your EOB if you're receiving that, and that's only when applicable. So let's talk about that. Reimbursement for pharmacy services. Remember, pharmacy is carved out of the Certified Workers' Compensation Network. You should not see anything about pharmacy on your network contract. So pharmacy services may not be delivered through workers' compensation healthcare networks. The reimbursement for pharmacy services should be according to our pharmacy fee guideline 134.503. Found on our website. You can use your DWC Finding Your Resources document to get to that chapter. Also, for pharmacy services, if your insurance carrier negotiates a contract directly with the pharmacy provider, and that contract includes a specific fee schedule, that is allowed. Also, informal or voluntary networks, basically only for certain types of services can an informal and voluntary network operate. And this is when they negotiate a contract directly with the healthcare provider on the carrier's behalf, and that contract includes a specific fee schedule. This is a very small part of our market, but there is an allowance by the statute for informal voluntary network contracts for pharmacy services, as well as DME, durable medical equipment, and home health services. So those services and their reimbursement follow either a network contract, or if there's no network contract, the division fee guidelines, or an informal voluntary network that negotiate a contract directly with that healthcare provider, either DME, home health, or pharmacy on that carrier's behalf, and that contract includes a specific fee schedule. Now, if you've sent your bill in, now you've gotten your EOB back, you know what the reimbursement should be according to your contract or those few exceptions, and you're dissatisfied with the amount. You disagree, and there's a dispute. So dispute resolution for network medical bills. Let's talk about it. On the left-hand side is the type of denial, if you will. On the right-hand side is the dispute path you will follow. These are for network claims only. On the left, if you're denied, your EOB says, we're denying you for compensability or relatedness or extent of injury. You're going to follow the the Division of Workers' Compensation Benefit Dispute Resolution Hearings process. On the left, medical necessity disputes. If they're denying, saying, we don't deem this medically necessary, you're going to go on through the IRO process. That 1 and number 2 are very similar to the non-network paths for dispute resolution. Where it changes completely is the medical fee disputes. So if you believe the reimbursement you got is not according to contract, you may not come to MFDR. You go through the network complaint process. And where do you find the network complaint process? That would be in your contract. Let's go over CERL disputes, compensability, extent of injury, relatedness, or liability. Now, the insurance carrier, this is a good thing about the network. If you're a network doctor, the insurance carrier is required to notify you if the carrier is contesting compensability. That's not the same on the non-network side. So a plain language notice number 1, which is a denial for the claim in its entirety, that's on compensability. The carrier has to send you that. So as a healthcare provider, you should be receiving those PLN ones. It's not the same on the non-network, so this is a network feature. And payment must be made for medically necessary services prior to providing that PLN 1 to you, that notification of dispute on compensability. So the carrier must pay up until that date that they provide that. If the carrier goes through all the dispute processes and they successfully contest compensability, meaning they prove that the injury did not happen in the course and scope of their job, or it met one of the liability exceptions, and they win. So it's no longer a workers' comp claim. They still are liable for up to $7,000 of healthcare provided before the notification occurred. So that's $7,000 in reimbursement. So you may not be out completely. So check on the date of the PLN 1 and when your dates of service were. So know that that exists, and that's a special feature in Chapter 1305. For compensable extent, liability, and relatedness disputes, you would follow the benefit dispute resolution, like I was talking about, the hearings area. Chapter 410 of the Administrative Code, Labor Code, Chapter 410, adjudication of disputes, talks about all of these processes. And they start with benefit review conferences. And then if it's not resolved in a BRC, benefit review conference, there's up to 2 there. It's sort of an informal mediation where everybody can agree or not agree. If they don't agree, it goes on to a contested case hearing. It's the same as non-network. There is an option for arbitration. Most people don't choose that. Most people go through the contested case hearing. The reason they don't go to arbitration is because there's no appeal process after a decision. Contested case hearings, those decisions can be appealed to appeals panel. And then if you are still dissatisfied, you can go on to district court from there. That's generally the path for compensable extent of injury, relatedness, and liability disputes. Now, on the second type of denial, medical necessity. We've given you these flow charts before, but just know that this is the network pre-auth and concurrent review process. So you ask for pre-authorization, you've gotten a response that's an adverse determination, you can appeal that, and then go to an independent review organization that does not work for the network or the carrier and have those doctors look at your appeal from there. The requester or the injured employee can do this. I suggest the person that's prescribing the service that has the medical record justification to go through all of these steps to get to an IRO. Here is the flow chart for the IRO process and all the deadlines. Won't go through this in detail, but you should have that in your handout. So that's the medical necessity denial process. Now let's talk about fee disputes. This is where it's different than non-network. So if you're a network provider and you're dissatisfied with the amount that was paid, you're going to resolve those disputes through the network complaint process, not through MFDR. Not unless you're a designated doctor. You can go through MFDR. Remember those exceptions on that slide that are paid according to the medical fee guideline, those can go to medical fee dispute resolution. But if it is anything other than that, you're going to go through the network complaint process, not MFDR. So if you were to submit a dispute that we find out there's a business contract between you and the network, we don't have jurisdiction over those, generally speaking, and you may receive a dismissal. Network fee disputes filed with MFDR will be dismissed with just a few exceptions. Out-of-network healthcare providers that got that special written approval can be resolved through medical fee dispute resolution. Now, the network complaint process, to become certified to operate as a network, they must have a complaint resolution system in place. That's according to the statute, 1305. So they have to have it in their contract. If you check your contract and do not see one, then that's a problem. You need to call the network and ask where the network complaint process is. Where are those steps? Maybe it's on their website. It's got to be available to you. And the network may require the complaint to be filed not later than the 90th day after the event. So don't drag your feet on filing that complaint. They may, in your contract, have a deadline to say, after 90 days, you've missed the deadline to file that complaint. So check your contract. Must include a process for notice of the complaint and an appeals process. They must tell you they got your complaint within 7 calendar days after the complaint is received. And that acknowledgement that they're sending to you must include a description of the complaint process and deadlines. And they must investigate and resolve the complaint within 30 calendar days after receipt of a complaint. They have to record all of this activity. It's part of their certification requirements. Also, there's some prohibitions on retaliation. The network may not retaliate against an employer or an injured employee if they filed a complaint. The network requires the healthcare provider to post in the provider's office a notice of the injured employee's process for resolving a complaint. So if you sign that contract, I'm sure there's a part of that contract that says you need to post notices so your injured employees know what to do if they want to file a complaint against their network. So if you have an unresolved complaint after you've gone through the network's complaint process, you can file a complaint with the Texas Department of Insurance on our online complaint portal. In the Texas Administrative Code 10.122, submitting complaints to the department outlines this process. So first step for a fee dispute that's a network claim is go through the network complaint process. The second step, if it's still not resolved, is to file a complaint with the network complaint, the online complaint portal at the TDI's website. Let's talk about report cards. Some people are interested in what networks are, considered good or bad, or which ones are out there in my area. I just want to know more about networks. We, as a Division of Workers' Compensation, are required to publish network report cards. You'll find that in the Labor Code 405 and the Insurance Code, Chapter 1305. We have a group that does research at the TDI called the Workers' Compensation Research and Evaluation Group, sometimes referred to as the REG, R-E-G. They evaluate the impact of networks in our system and the cost and quality of the medical care provided to the injured employees. And they publish annual information report cards on our website. In those report cards, it includes injured employees' access to care. How fast are injured employees getting to those doctors, and do they have an adequate number of doctors and specialists? Return to work outcomes. Again, that's our mission and goal of the workers' compensation system. You'll see the return to work outcomes outlined in those report cards. Health related. Are the employees satisfied with the care? And what are the costs and utilization? Those are information, those points are information in the report cards. Just to let you know, under N for networks, you can find those. We glanced at them earlier. So a review of the information that we've reviewed today is what is a network and how can I join one? The network requirements, intake, registration. Make sure your intake and registration staff is trained. This is important for the viability of your clinic. You need to identify those network claimants as soon as possible. And then what requires pre-authorization and what are the steps for it? Medical billing and reimbursement, dispute resolution, and those report cards. So, did I train your brain okay? Let's see if we can use those muscles with these polling questions. Question number 1. When a healthcare provider wants to join a workers' compensation certified network, where do they send the completed application? The answer is you send it to the individual certified workers' compensation healthcare network. You do not send it to the Division of Workers' Compensation, and you do not send it to the Texas Department of Insurance. You're doing business directly with that network, and that's where the contract, those two parties to the contract are. So send your application to the network, not to us. Question number 2. Does a healthcare provider's intake team need to determine if the injury is a network claim or not? That is true. If you want to avoid denials because you happen to be treating a network claim and you're not contracted. So the answer is true. Your intake and registration department needs to be trained on how to find that information out. Number 3, each contract, network contract with a healthcare provider outlines the network's pre-authorization requirements. That answer is true. Number 4, generally, reimbursement for healthcare provided to a network claim is determined by your contract. That is true. Generally speaking, I listed those exceptions in those slides before. Number 5, the last question is network fee disputes are resolved through the network complaint process. not through the Division of Workers' Compensation fee dispute resolution area. That is true. You have to go through the network complaint process. Do not send it to medical fee dispute resolution. That is true. So thank you for participating in that. I hope that it kind of drove it on home, that you understand how the networks work. Next time, now that you've gotten over that wall, the last obstacle is really about returning to work and how healthcare providers help with returning to work and that work status report. So you're going to be in the medical tent getting ready to return those injured employees back to work. Your learning objectives are to know the benefits of recovering while still on the job and reducing medically unnecessary time away from work, know how to complete and understand the work status report, and know the rule that addresses return to work and the form. Here is contact information for the area of Texas Department of Insurance that certifies workers' compensation healthcare networks. You can email questions to wcnet@tdi.texas.gov, call that number, that 866 number, and then there's a link to their area on our website. You can always call us at Comp Connection, 800-252-7031, option 3, or email us at compconnection@tdi.texas.gov. We'll always take your questions and we'll try to get you to the right place or answer your questions.